Hi, my name is Kelsey Aiken. Today I would like to discuss with you the career of nursing. Nursing is a very broad industry as there are many different types of clinics and many different settings for a nurse to work in. You could be inpatient in surgery, NICU, ICU, or mother and baby, or you could be outpatient in like a diabetes, a nephrology, or a podiatry clinic. The overall job of a nurse is mostly the same in all of these different settings. However, there are some differences. In the majority of outpatient settings, the nurses do a lot of triaging complaints and phone calls for doctors from the patients, whereas when you're inpatient, you do a lot of the lab ordering, medication passing. You teach patients hygiene habits, especially when they're in for wounds or they have something like a wound vac, how to function with that. You also do pulmonary testing inpatient, monitoring the labs, taking vitals, helping the patient with using the restroom when they're not ambulatory, and recording intake and output for them. The biggest thing a nurse does is a nurse educates her patients, well, his or her patients. This is highly important as many patients with chronic conditions do not understand what is going on with their body and why it's happening. Some even blame themselves. My experience in diabetes clinics taught me that. I talked to numerous patients about how to take their insulin, as well as the fact taking more insulin does not make you a failure. Chronic conditions are very hard for patients to understand. It is very important that nurses educate them as much as they can and to break it down to a level that they actually, the patient, can understand and explain. As far as wages and salaries go, new nurses do make the least because they are beginners. They price out between $23 and $26 an hour. That does not include any holiday pay, overtime, or on-call pay. The maximum a nurse makes normally is about 42 hours, depending on the location and type of clinic they're in. Your hospitals like Detroit Mercy and your public hospitals pay their nurses a lot more than they do in private practice. And then Detroit Mercy, because it does have such a high risk area involved in it, nurses do normally get paid a little bit more. The nurse goal, what you want in a nurse, is a person who has high standards of professionalism. You're going to have a lot of different types of patients. You're going to have patients who are illiterate from different ethnicities and backgrounds. And making assumptions and just stereotyping them is not the way to treat them. You are there to help them understand their condition. You're there to treat their illness, not their background and what they come from. Every patient is an individual and deserves to be treated with the utmost respect and dignity, which is a very important characteristic that a nurse should have. Another important strength of a nurse needs to be her or his way of communicating. Not only do you need to be able to speak to a patient, you need to be able to listen, to understand, and to empathize with them. Patients are scared, alone, and hurt. And as a nurse, you need to understand that and make sure you are treating them with the utmost respect. And then also, it's very helpful to have a sense of humor. A lot of times you are working in a very stressful environment. People are sick, people are angry, you're getting yelled at for things. And you just need to be able to find a way to relax, to enjoy the better times, and take it all in. Education-wise, the easiest way to do it and the most cheapest would be to start out at a community college like Clanton Community College and do a 2-year program. That'll get you your RN. but most places require you to move on after. So this would be getting your Bachelor's of Nursing Science, which normally is done at a larger university like Michigan State University or Grand Valley State University. And those are a bit more pricey. School is costly, but the salary kind of outweighs the loans you have to take out. You get frequent raises depending on your union or if you're non-union. There's overtime, call-in pay, and holiday pay, which is time and a half. So taking that $42 or heck, that $26 doing time and a half, that's a lot of money. Another disadvantage to school would be the long hour, or to nursing, would be the long hours. Inpatient nurses work about 12-hour shifts, and that's not including if the person who's supposed to relieve them does not show. If they don't show, then it's unfortunately up to that nurse to stay until supervisor can get somebody else in, which can really upset a lot of people. But then you have to remember, you are there to care for the patient. You are not there for the money. That's a big misinterpretation when it comes to nursing. The career ladder of nursing isn't really a ladder, it's more of a lateral move. There are positions that are thought of as higher positions, but they're not actually higher. You might have more responsibilities, but chances are if person A and person B are working the same position and person B moves to a different office, different location, different inpatient location, they could potentially work the same. What I have found with speaking with the nurses I know is it's highly regarded working mother and baby. And that is, you have a lot more patients. Where you normally on an inpatient, you might have 3 patients. In this case, you would have 6 because you have both the mother and the baby. And even mother and baby nurses are responsible for those babies in the NICU. They are to help the mother get to see the baby in order to help manage any conditions that are going on. So really there's not like a career ladder. There's more of just like that position's better because it's highly sought after and highly regarded. And then as far as outlook goes, according to the Bureau of Labor and Statistics, from the years 2018 to 2028, there will be a 12% increase in the required amount of nurses. So that means a lot more positions. This is a highly growing field. To kind of give you an idea, I've taken a chart I found on the Labor Bureau and Statistics and drew it out a bit more clear than what they had. So, it is employment changes in the percents from the years 2018 to 2028. At 13%, you have other healthcare providers who are more like the doctors or the nurse practitioners, the physician assistants, those who actually diagnose people. They're a growing field as well because there's money and there's a lot of sick people. You want to help them. Next you have registered nurses at a 12%, a growing field. And at the bottom, at 5%, there is the total of all other occupations. So the average of what it is about 5%. That's your lawyers, your teachers. It's rather low. It's amazing that nursing is actually double what is wanted out there. So that's my spiel on nursing. I hope anyone who sees this who's thinking about going into nursing really strongly considers it, does your research before just signing up because you think it's money. It's a lot of education. It's a lot of teaching people and patience and understanding. And that's where some nurses rock it and some fall flat on their face. That's what makes the difference of patient-centered care facilities, is how you are treated. especially by your nurse. She is, or he, is around you quite often. Thank you for your time.